Hello, 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 and thank you for joining us. Welcome to the 2020 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is Best Foot Forward, Type 2 Diabetes Foot Care. Type 2 diabetes foot care. Did you know that high glucose values over time can increase the risk of foot infections and deformities by reducing blood flow and causing nerve damage? Today we'll learn about how to keep your feet healthy. My name is Jo Mandelson, registered dietitian nutritionist and associate director of nutrition here at the American Diabetes Association and your host for today's program.
And hello, everyone. Good afternoon. This is Shamira Robinson, registered dietitian nutritionist, diabetes care and education specialist, and director of nutrition at the American Diabetes Association. And of course, your co-host for today's program. Remember that our Ask the Expert series is all about answering questions from our listeners. So start getting those questions ready right now. For those of you on the phone, press *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the chance to ask your question live. If you're online, no worries. You can still participate by typing your name and question in the fields below the streaming player. All you have to do is press the Submit Question button, and once you do that, your question will come directly to us. Stay with us through the hour, and we will send useful resources to help you live well on your journey with diabetes. In addition, we invite you to provide us with feedback in our 5-question survey at the end of the event.
Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart. With support from founding sponsors, the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance and Novo Nordisk, as well as national sponsors Sanofi, AstraZeneca, and Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. The health and safety of all of those we serve at the American Diabetes Association is always our top priority. COVID-19 continues to be a serious public health threat. In general, people with diabetes face greater risk of complications when dealing with viral infections, and this is true with COVID-19. Current CDC recommendations to protect yourselves state that you wash your hands often. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put distance between yourself and other people. Cover your mouth and nose with a mask or cloth face cover when around others. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES. That's 1-800-342-2383. Like many of you, we are still practicing social distancing, so we are proud to be presenting this month's Q&A from our very own living room. Shamira, from my living room to yours, I'm going to pass it along to you to introduce our guest today.
Well, thank you for that, Jo. I am thrilled to introduce Dr. Gary Rothenberg. Dr. Rothenberg is a board-certified podiatrist, a certified diabetes care and education specialist, and certified wound specialist who currently holds a clinical assistant professor faculty appointment within the endocrinology division at the University of Michigan School of Medicine in Ann Arbor, Michigan. Previously, he served as Director of Resident Training and Attending Podiatrist at the Department of Veteran Affairs Medical Center in Miami, Florida. A graduate of the Ohio College of podiatric medicine. He completed 3 years of residency training at the University of Texas Health Science Center in San Antonio, followed by 4 years of private practice in Atlanta, Georgia. His previous private practice experience and academic practices within the VA and university settings have focused on conservative and surgical management of the diabetic foot. Education has always been his passion, whether working with students, residents, colleagues, or most importantly, people living with diabetes. Dr. Rothenberg believes education is the key to prevention of diabetes-related lower extremity complications. All right, Dr. Rothenberg, I know I covered a lot of your background, but why don't you take a moment to tell us a little bit more about yourself?
Thanks, Shamira. Thank you for the introduction and the opportunity to be here today. Again, my name is Gary Rothenberg, and despite the challenging times, I'm really appreciative of technology. I'm not in my living room, I have to admit. I'm in my office, but I'm in Ann Arbor, Michigan, and I'm appreciative to work with the great folks from the American Diabetes Association and the American Heart Association to bring you the program today. I hope I'm able to answer a lot of your questions about keeping your feet healthy, and I'm really excited to be here and answer your questions. Thanks so much for having me.
Of course, we are so excited to have you. And as we're waiting for our callers and our online listeners to chime in, I'm going to go ahead and kick it off with the first question. I know you mentioned healthy feet. Can you talk to our listeners a little bit and really give them the tips, the most important things they should keep in mind when it comes to maintaining healthy feet?
Sure. I think the first most important thing to do is to really follow established recommendations that the American Diabetes Association and other strong organizations that focus on keeping feet healthy, that what you all advocate. And the most important thing to do is really check your feet every day. Everybody with diabetes needs to pay close attention to their feet, and every single day make it a routine and a habit to look at them. Not only look at them, but I also encourage my patients to touch their feet, because sometimes there's parts of the feet that are very difficult to be seen. The bottom of the feet, for example. Sometimes we just don't have the flexibility or the ability to see the bottom of the feet. But if you touch your feet, then that would be really helpful. So each person with diabetes has a responsibility to check their own feet, and then it's on us, your healthcare team, to also help you in that process. So primary care providers will play a significant role, and everyone who goes to see their primary care doctor or their endocrinologist, if the visit is focused on diabetes, the feet should be examined by a primary care provider or endocrinologist at every visit. Now, the American Diabetes Association also recommends what's called a comprehensive foot exam to be done at least once per year. And usually that's when the primary care docs or the endocrinologists refer to people like me or a podiatrist. We spend a lot of time doing a comprehensive foot exam, and that's really going to help establish what's the status of a person's feet in terms of their circulation. And we know there's a significant relationship between cardiovascular health as well as foot health. So it's really important to focus on the circulation or the vascular supply to the feet. But there's really 5 systems that we evaluate comprehensively at that annual visit. The vascular or the circulation, as I just mentioned, nerve health and nerve function, the musculoskeletal, or what's going on with the structure or the architecture of your feet, if you will, in terms of bones and muscles and the ability to move. Another system is the dermatologic, or the skin. We look comprehensively at the feet, both in between your toes and what's going on with the toenails, to make sure that there are no abnormalities in the skin. And then finally, we really need to evaluate a person's shoes, because you can do everything correctly, but then wear the wrong pair of shoes, and a person with diabetes can end up in trouble. So that comprehensive foot exam will evaluate those 5 systems, but a person with diabetes should be looking at their feet every day.
Thank you so much, Dr. Rothenberg. That was a really great explanation. I just want to remind our listeners, if you're just joining us, welcome to today's Ask the Experts Q&A, Best Foot Forward, Type 2 Diabetes Foot Care. As a reminder, for those of you on the phone, press *3 on your keypad and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. A few items we'd like to cover today include caring for your feet, how to avoid problems, the relationship between complications of your feet and heart disease, and how nerve damage generally related to high blood glucose levels can impact your feet. All right, so let's go ahead to our first caller. We have Marie from South Carolina. Marie, you are live and on the air.
Okay, thank you. I just had a question about soaking your feet, and I've just kind of received conflicting reports. Some doctors recommend that you do, and some doctors recommend that you don't. So I would like to know what would be the proper thing to do. Do I soak mine, or I don't? Just wash them, no soaking.
Well, thank you for the question, Marie. That is one thing that has conflicted a lot of people over time, so you're not alone in that one. In general, it is not recommended to soak your feet. We get worried about people with diabetes and their nerve function, that if you have what we call neuropathy or some nerve damage, that soaking the feet may actually cause injury, such as if someone makes the temperature of that water too hot that you can't feel it because your nerves aren't functioning properly in the feet, that you could actually end up with a burn on your foot. So the reality is also most people will put in Epsom salts into those soaks, and that will actually dry the skin out. The only indication for soaking, in my experience and in my opinion, is if you believe you have an ingrown toenail where there's actual inflammation or infection coming from underneath the toenail. And then the soaks would be done under the direct supervision or recommendation of your specific healthcare provider or podiatrist. In general, we do not recommend soaking for several reasons, including it'll dry your feet out and for potential of injury.
Okay, thank you so much, Doctor. So I'm going to go ahead and go to our next caller. We have Donna. Donna, you are live and on the air.
Thank you. Do diabetes tend to get toenail fungus?
Yeah, very common concern among people living with diabetes is toenail fungus. And it is more common for people with diabetes to develop toenail fungus. And usually what you'll see is a discoloration. It can be either yellow, even towards brown or black of the nail. Along with thickening, they become very brittle. They're hard to trim. It does represent an infection, but it is a local infection just right there in the toenail. The silver lining or the good news of toenail fungus is it will never cause people to become sick. It doesn't get into the blood system. It does represent an infection, and so people living with diabetes, because of their immunocompromised status, just by having diabetes, it is harder to fight off the fungus infection in the toenail. So the long answer to your question is yes, we do see toenail fungus more commonly in people with diabetes, and there are several ways to treat it that you can discuss with the healthcare provider that you see on a regular basis.
So I think that actually transitions really well to one of our online questions too, Dr. Rothenberg. Ken from the online community is asking if you could talk a little bit about what the early signs of foot problems may be.
Yeah, so we know that about 1 in 4 people will be diagnosed with diabetes because of a foot-related problem. So even as a podiatrist, I have a role to play in determining and diagnosing people with diabetes. We see that again, very commonly. A lot of the early signs will go back to the systems that I mentioned, and circulation is one of them. Remember that our circulation is like a big tree, and there's branches off of that tree, and everything starts with the heart. So we know that circulation is really important. So sometimes the evidence of poor circulation could be reduced or diminished pulses in the feet, where we can't feel the pulses in the feet, and that could be an early sign of poor circulation, which is associated with diabetes. But more commonly, what I see is early signs of diabetes include wounds or blisters or sores that don't heal in a quick fashion. In other words, typical of wearing a pair of shoes that may be too small, you rub a blister, and that blister takes a long time to heal. That could be an early sign of diabetes from the feet. And then the other big one is going to be nerve type symptoms, including tingling, burning, numbness, pins and needles feelings in the feet. And those could be warning signs of diabetes or worsening control of your diabetes. A lot of my patients know their sugar is high because their feet start to tingle, or they start to hurt or ache. Some people, their manifestation of high blood sugar may be that they're thirsty or hungry or irritable. I ask a lot of my patients, and they tell me, I know my sugar is high because my feet are bothering me. So I think it's related to circulation, nerve function, and then wounds that are delayed in healing. Those could be some of the early signs of diabetes or poorly controlled diabetes.
Okay, thank you so much. So let's go ahead and go to our next caller. We have Leola from Baltimore, Maryland. Leola, you are live and on the air.
Hi, how are you?
Doing well this afternoon. Thank you.
Yeah, I have problems with my feet. I think it's neuropathy starting to settle in, and sometimes they sting around the toes and they burn a little. Now, I take very good care of my feet. I make sure I check them every night, and every night this is what I do. I oil them down with Vascular, and then I put the lotion on them. And then I have a that they say will stop the stinging and the burning. I put that on there. So I'm trying my best to maintain my glucose as well as I can. The glucose control, I'm doing that because I don't take any kind of medication for it. So it's diet and exercise. What else can I do?
Yeah, well, I think you're doing the most important thing, and I congratulate you and thank you for checking your feet every night. It sounds like you're really paying attention to them, and I think that's important. So I like the fact that you're physically touching your feet, applying that cream or lotion every night. And it is most common that people with diabetes and neuropathy, that in the evening they feel those sensations more strongly than during the day. And there's probably a couple reasons why that happens. One, because we're all busy during the day and we're not paying attention as much. Those symptoms may be there, but we're just busy living life. So there's something about that happening in the evening when we tend to pay more attention to the things that are going on in our body and our mind as we're laying there in bed at night. So it is very common that we see neuropathy symptoms occur more commonly in the evening. There are some good creams, as you mentioned, also that are geared or helpful towards those burning and stinging sensations. A lot of them have a little lidocaine in them. That's the same product that our dentists use when they have to numb up our mouth and do something in the mouth. So some creams with lidocaine oftentimes can be helpful for those neuropathy type symptoms. But you also mentioned that you're keeping your sugar under good control, and that's most important as well. And so those are the ways to avoid the long-term effects of neuropathy, is to keep your sugar under good control, check your feet every day, and then treat the symptoms. If it keeps you up at night or awakens you, then talk to your healthcare provider about other options or how to control those symptoms. But good job checking your feet every night.
Thank you for that, Dr. Rothenberg. I think that was a very well-rounded answer to that, and I know we've been getting a lot of questions about neuropathy. Another topic that we're getting a lot of online questions about is related to pedicure. So a lot of people wondering if they should be going to nail salons to get pedicures or not. Do you have any recommendations or any quick tips for people who are asking about pedicures?
Yeah, that's a great question. Another controversial one. I would say if you have any risk factors associated with your diabetes, indicating that you have poor circulation or that you do have neuropathy, if you've had problems with blisters or slow healing wounds, if you've had open wounds that have led to complications like infections or even amputations of toes, it is not a recommendation to seek services of a pedicure. That's when you need to see the healthcare professionals and the foot care specialists to do that type of nail care because insurance recognizes that the high risks that people who have already had complications associated with their diabetes, that you're too high risk to go out and leave it to somebody else. So in someone who has diabetes and has normal circulation, has normal nerve function, it may be appropriate to seek services of a pedicure. And I do have specific recommendations. If you do get a pedicure, that you have to go to a salon that uses disposable plastic liners in their whirlpool. So if they put you in a whirlpool first, and there's no disposable liner, and they say that they sterilize or that they clean that basin between clients, there's no way that they can leave enough time and clean it appropriately in between clients. So if they use a disposable plastic liner, that's recommendation number one. Number two is that the instruments that they use should be individually packed and sterilized, not sitting in a basin of alcohol or some other solution on the table in the back. You want them to open those instruments in front of you, that they've been individually cleansed, packed, and sterilized. And finally, that you ask the person to just cut the toenail straight across, that they don't dig into the corners, because we've seen plenty of times where patients in the office with ingrown toenails from seeking pedicure services. So I think it really is based on the risk factors that you have. And again, you have to have that comprehensive foot exam and then ask your specific healthcare provider if he or she recommends a pedicure or recommends against it.
Those are all really great points about pedicures. Thank you so much. So we're going to go on to Diane from Utah. Diane, you are live and on the air.
Hello?
Hello, Diane. Can you hear us?
Yeah, I can hear you.
Did you want to go ahead and ask your question?
I can hear you.
Okay, it looks like we might be having some connection issues, but her question is about drying and itching after she takes off her shoes and socks. So I'm wondering if maybe you could talk a little bit about what's going on there, what you can do to help that, and then maybe that'll be a good transition into talking about socks and shoes. You mentioned that was something that we should be paying attention to.
Yeah, there's several reasons why feet may itch. The most common cause is going to go back to what we talked about with toenails, and that's fungus. Well, fungus can cause a problem with nails, but it can also cause, as we know, athlete's foot. And that's the number one culprit or reason why there might be itching on the feet, would be from athlete's foot or fungal infection of the skin. Other things, rashes, dermatitis, irritation from a component of a sock, a fabric, or a detergent, those types of things can cause itching as well. So those are the most common things, and we would need to examine and discuss things and look at it to see what's going on. But those are the most common reasons why the skin might be drying and peeling and itching, is from a dermatologic skin condition. In terms of shoes and socks, It is our recommendation for people with diabetes to never walk barefoot. Certainly not outside of your home and even in the house. We know that accidents can happen. Glass breaks in the kitchen or things, carpet staples and tacks come loose. And so just to protect the bottom of your feet, it is our recommendation for people living with diabetes, especially those with poor circulation or with neuropathy type symptoms, to wear house shoes, to wear a pair of old tennis shoes, even flip-flops, something to protect the feet when you're inside of the home, as well as certainly every time that you're outside. Shoes are protection, and we feel much more comfortable about people walking out and about. Even in the summertime, I know this was just Labor Day weekend, and some people might have gone to the beach or to the ocean or a lake, and that's especially when people with diabetes need to protect their feet as well against the hot sand of a beach or against shells and things, rocks that might be on the water's edge. Socks are important to wear as well because they serve as a cushion and a protection between your actual foot and the shoe. It's usually our recommendation to wear white socks because that way if you were to develop a blister or some sort of an irritation that might cause drainage, that even if you didn't feel it, that at the end of the day you might see it onto the sock. And we like socks that breathe, so usually cotton socks are a good choice, and they do make special diabetic socks, which are a little bit of a wider weave and not so constricting. Those can be really helpful for people living with diabetes as well.
Okay, thank you so much, Dr. Rothenberg. We actually have another question about shoes from Cynthia in Manchester, New Hampshire. Cynthia, you're live and on the air. Cynthia, can you hear us? Oh, it looks like we might have lost her too. But she was saying that she has small feet and bunions and needs new shoes. She's wondering if you have any recommendations on where she can get help to find those shoes.
Yeah, it can be a challenge to find comfortable shoes, especially if you have some foot deformity like a bunion. And those tend to be genetic and run in families, but I empathize with the challenge a lot of women have with finding comfortable shoes, especially because if you have a bunion, then you have a wide front part of the foot and a narrow heel. I wish I knew a place in Manchester, New Hampshire, but probably she needs to seek out the local podiatrist because I know I make it my business to find the family-run shoe stores, the more specialty shoe places in my town to refer patients to. I find it a challenge for people to purchase shoes online. I don't think that's a great option. So I think it's a challenge, but she probably has to find the local place in her community to find good shoes in the best fit.
I think we're just going to have to get you a map to Manchester, New Hampshire, huh?
Right.
But I think that's a great recommendation, go to the specialist who makes it their business to know who can help with these types of questions.
Yes.
All right, so we have another question about socks from Carol. Carol in Pennsylvania, you are live and on the air.
Hi, can you hear me?
Yes, we can.
Okay. My podiatrist, I've just visited him last week, suggested that I wear compression socks. But I didn't think of asking him, do I wear them just when I think my legs are swollen and feet are swollen, or is this something that one wears 7 days a week for 365 days a year?
Yeah, great question. So compression socks are generally recommended for people that have issues with swelling of their feet and ankles or their lower legs. Again, it goes back to the relationship between the heart and the lower extremity or the feet, because oftentimes the heart has trouble pumping that circulation tree all the way down and then also all the way back up. So usually the recommendation for wearing compression socks is all the time. If you have every day, if you have issues with swelling, then the best way to prevent swelling is with those compression socks as well as with elevation. So usually the recommendation would be to wear them every day, and I recommend to my patients put them on first thing in the morning and take them off at the end of the day. You do not sleep in compression socks. And if you try and put them on midday after you've done your morning routine and maybe run an errand or two, there's no way they're going to go on because you've already allowed some swelling to happen. So you put them on first thing in the morning, take them off at the end of the day, and generally the recommendation is to wear them every day.
Great question. To follow that up, we're still talking about shoes and socks, but I have another twist to it. Riva from the online questions is asking, are gel inserts okay to use, or do these types of products rub too much and cause more foot problems?
Yeah, so it depends what the problem is. And again, a foot exam with a specialist is probably where you need to start. The gel inserts generally are okay. They will provide cushion and shock absorption. And if you're just looking for a little comfort, that's fine. But over-the-counter inserts, like the gel inserts or even some of the foam inserts, are made for a generic foot, not too high of an arch, not too low of an arch, and they also come in a range of sizes. So oftentimes they just might not fit your foot well, and so it depends. They should feel good and provide some support, whether they're made of gel or foam, which are the two most common materials that they'll be made out of. The other pearl or consideration is oftentimes you can't put one of those inserts into your shoe without removing what's called the sock liner. For example, if you wear athletic shoes, doesn't matter if they're Nikes or Reeboks or New Balance, there's going to be the sock liner which says the name brand on the inside of the shoe. The recommendation is always to pull that sock liner out and put in the full length insert that you buy over the counter. Otherwise, the shoe is going to get too tight and you might crowd the toes. A lot of people just think to put those inserts in and go about their business, but then they're not comfortable because the shoe has become too tight to accommodate that over-the-counter insert. So oftentimes they can be helpful. They can provide support. They can provide comfort. But again, specific recommendations might be best served by having an evaluation and let the foot care specialist make a recommendation about the type or the brand or the style of insert that might be beneficial.
I love that, and I think that is so helpful for everyone looking for ways to add more cushion and to add more comfort to their shoe. Just for everyone, in case anyone is just joining us, we are talking all about maintaining healthy feet today. So whether that is taking care of your feet, your visit with your healthcare team, what types of shoes, compression socks, we have talked about it all. And if you have questions, all you need to do is press *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. If you're online, we love to see those questions continue to file in. So just enter your question into the box you see below your streaming player, and once you press submit question, that will come directly to us. Okay, Joe, what question do we have next for Dr. Rothenberg?
Well, so we have a couple of questions online about cold feet. Specifically, are cold feet caused by diabetes, or why do feet feel ice cold when lying down? So maybe you could talk a little bit about that.
Sure. So the thing that I worry about most when I hear people talk about their feet turning cold or their toes turning purple is the circulation. I think we've mentioned multiple times, but can't underscore enough the relationship between heart disease and the circulation that's coming all the way down to the feet. So the first thing that I would want to make sure in somebody who tells me that they have cold feet is how does the circulation appear? And there's two places on the foot that I can feel for circulation. One is on the top and one is behind the ankle. So there's actually two pulses in the foot. And when we can feel those pulses, we feel better about the circulation. And if I'm concerned about not being able to feel those pulses or that there may be evidence of poor circulation, then I typically would recommend and order what are called non-invasive vascular studies. Non-invasive meaning no needles, it doesn't hurt. Essentially, they take blood pressure cuffs, put them around your big toe, the front part of your foot, your ankle, your calf, and your thigh, and they squeeze these cuffs really tight, just like squeezing your arm for a blood pressure, and they can get a reading of how the circulation is. So oftentimes we do an initial exam, we listen to what people are saying about their circulation in terms of feeling cold, purple discoloration, and then we feel for the pulses, and if we feel them, then that's better. If we don't feel them, usually we move on to tests. The other thing I would mention is there is a strong relationship between diabetes and heart disease, and it goes without saying, smoking and heart disease. And those three things do not play well in the sandbox at all: diabetes, heart disease, and smoking. So if you do smoke, we highly encourage trying to cut back and quit smoking because of the risk of poor circulation.
Thank you for that. And I know we talked quite a bit about the relationship between keeping your heart healthy, making sure that you're doing your best to manage your diabetes, and how all of those things affect your feet. And I know that you've also mentioned the importance of checking your feet every day. So for our listeners who may not be checking their feet currently, how do they go about doing that? What do you recommend for someone who hasn't been checking their feet, but they're wanting to start? What are they looking for? What should they be doing?
Yeah, let me first acknowledge it's a challenge living with diabetes every day, right? It's unrelentless. It's with us 24/7. So some days it's a challenge to remember to do all the things that we have to do in addition to checking blood sugars and dosing insulin and taking our meds and doing all those things. But I think habits are important. And I tend to recommend that you leave a bottle of cream or lotion on the night table. I think that's your visual cue to every day pay attention to your feet. And I have decided it doesn't matter what kind of lotion you use. It doesn't matter to me. It's just the consistency with which you use something. So I think starting by checking your feet every day, just use that lotion as I talked about earlier. Yes, we want you to look at your feet, but sometimes, as I mentioned before, it's a challenge to see the bottom of the feet. So just put some little bit of lotion in your hands and rub your feet and make sure as you're touching that you're feeling for any new bumps or blisters or bruises, anything that's on the feet that you're discovering today that wasn't there yesterday. And so that's really doing a good foot check. And if that bottle of lotion is there on the night table, you probably remember to make it a habit to do it every night before bed. Just start with that simple thing of adding some lotion. Prevents cracks and fissures and open cuts to the foot, but it also is important to having you check your feet every day as part of that process.
I've also even heard that some people will use handheld mirrors to try and take a look at, see what's going on down there and under the feet as well.
It's a great option. Put a mirror on the bottom of on the floor, and then hopefully, it helps to see the bottom of the feet. If you have a spouse or significant other or somebody else that can help as well, take a look at the feet. It's just too important not to do it. So we really encourage paying close attention to the feet all the time.
Right. All right, so let's go to some of our listeners. I have Adrian from Pensacola. Adrian, you are live and on the air. Adrian, can you hear us? All right. It looks like we might be experiencing some technical difficulties, so just be patient with us. But her question looks like it was related to amputations, specifically if diabetes causes people to have their feet or legs amputated. So maybe you could talk a little bit about anything that relates to amputations.
Yeah, so unfortunately, about 80% of the amputations that happen in the United States that are not associated with trauma, so motorcycle accidents or things like that, but 80% of the amputations that are performed in the United States unfortunately happen because of diabetes-related complications. So the number one causal pathway or reason why people with diabetes may end up with an amputation is because of an infection. An infection that goes unnoticed, and it usually starts with an open wound to the foot. And what puts people at risk, and why we've been talking about the importance of circulation and the importance of nerve function, is because if you do develop a blister or a sore, we want there to be enough circulation and for you to feel that wound or problem on the bottom of the foot so that you're aware and that you can do something about it. So usually the pathway starts with a patient who has neuropathy, ends up with some sort of a minor injury, whether it's they step on a carpet tack or a staple that becomes loose, or they end up stepping on a nail, or they end up wearing a pair of shoes that rubs a blister, and then with the neuropathy or the nerve damage, they don't feel it. And then the infection is allowed to happen because there's now an open wound, because represents an opening between the outside world and the inside world. Bugs and bacteria get in there and they cause an infection. And then in the presence of poor circulation, those wounds struggle to heal, or if the infection is allowed to get deep enough where it enters into the bone, then unfortunately, oftentimes the result is an amputation. And that's what we're trying to avoid by doing those daily foot checks, making sure your sugar is controlled, understanding the relationship between circulation and feet, because ultimately we want to prevent those complications of infection, wounds, gangrene, or very poor circulation to the feet, and ultimately amputation.
Right, really, really important points to know there, and it really highlights the importance of checking our feet and the importance of foot health. All right, so let's go to Silvio in New York City. Silvio, you are live and on the air.
Okay, good. Thank you. Well, my question is if I have some numbness on my toes, okay? And I wonder if there's any remedy to that, if I can take anything. Somebody suggested vitamin B1, but I'm not sure. And I bought some over-the-counter things that don't seem to work. It's kind of numbness on the toes together with the big toe. That's something else. And I don't know how to deal with it.
Yeah, so thank you for your question. So neuropathy or nerve issues associated with diabetes are exactly what you're describing. They're very typical in that they start at the tips of the toes and they can work their way backwards, meaning involve more to the middle part of the foot and then up to the ankle, and then I have patients that have numbness up to the knees. The number one thing you can do to prevent progression of neuropathy symptoms is keep your sugar under good control. And that's easy for everyone to say, and I acknowledge the challenge that represents. So easy to say and hard to do, and we understand that. But keeping your blood sugar controlled and your A1C in a desired range can help prevent the progression of that numbness and those symptoms. So some medications can work, whether they're topicals, sounds like some of the creams and lotions that we talked about earlier that you're also trying. There are some oral medicines that you can discuss with your primary doctor or your endocrinologist or your foot doctor. And usually the threshold is when it's interfering with your sleep cycle. So you can't fall asleep because of the numbness and tingling and burning that people experience. or if in fact it awakens you in the middle of the night. Those are usually indications for oral treatment, oral medicines that treat neuropathy type symptoms. But the number one thing to do is to keep your sugar under good control and try and continue to fight that fight that is diabetes every day.
Thank you so much, Dr. Rosenberg. All right, so let's go to Debbie in a 302 area code. Debbie, you are live and on the air.
Hi, thank you. First of all, you've been great. You've answered a lot of my questions that were in my head already. But one of the things I was wondering is how long does it take of an uncontrolled A1C to have any kind of foot problems? Is it years or?
Yeah, thank you for the question, and thank you also for listening today. It's a difficult question to answer. I wish I could tell you that if your A1C was 9 for 6 months, that you were going to develop neuropathy. It is different for everyone, but we do see that temporal relationship with the longer you live with diabetes and the more poorly controlled it is, then the higher the risk of developing complications like nerve damage, poor circulation, wounds. There's no specific answer to your question because, again, some people we diagnose with diabetes because they're having numbness in their feet or because they show signs of poor circulation. So there'd be no way of us knowing how long have you had diabetes or elevated blood sugars. We can look at studies and research, and the estimates are, when we diagnose somebody with diabetes because they have neuropathy symptoms, they've probably had elevated blood sugars for about 5 years that have gone underrepresented or undiagnosed. So no hard and fast rule, but flip it around and take the positive approach would be keep your sugar under the best control that you can, keep your A1C in the desired range, and your risk of developing complications is much smaller.
Thank you so much. We have another great question from Barbara in Michigan. Barbara, you are live and on the air.
Hi. I want to really express my appreciation for this program. It's answered a lot of questions already. But I have been a type 2 diabetic for 30 years, and I've gone in and out of control several times. Lately, in the hollow of my heel, between the ankle bone and the heel, I have what looks like broken blood vessels, and it's on both feet. There's no pain associated with it, but I do have neuropathy, and my ankles are partially numb. And I'm wondering, I also have heart disease. I'm wondering if there's anything I can do, if this condition will lead to anything more serious. And my blood sugars are under the best control they've been in 30 years.
Well, that's good. Barbara, my fellow Michigander, nice to speak with you. So I would say the broken blood vessels, oftentimes those represent what we call spider veins or even varicose veins. That's what it sounds like to me. I think it sounds like you're doing everything that you can by paying attention to them as well. I would just, usually those don't cause a problem unless swelling is also an issue. We talked about swelling in compression socks earlier. So if swelling is a persistent issue and you have issues with your veins, there is a risk that the skin is only so strong and eventually you could develop a blister or an open sore because the leg functions like a balloon at that point and eventually it's going to burst. So if swelling is an issue, I would be more concerned. If there's not too much swelling and there's no itching and there's no other associated symptoms with those broken blood vessels or spider veins, it sounds like, then I would not be as concerned. Those tend to be genetic. They run in families. We also do see them in women more. It may have something to do with pregnancy and standing on your feet and just the ability of those veins to withhold pressure. So unless there's issues with swelling, I'm less concerned. If there are issues with swelling, I think you ought to see your primary doctor or endocrinologist or your foot doctor and take a look at those.
All right, so it looks like we have time for probably one more question. So I have Debbie from a 904 area code. Debbie, you are live and on the air.
Thank you. Number one, I know we've covered toe fungus, and I want to know two questions. Whether or not I can use nail polish on my nails after I've had a podiatrist remove the nail and it's growing back. And also, I was told not to use lotion between my toes.
Great. So I'm really glad you brought that up, and I should have before. I appreciate what you said about the lotion between the toes. That's a great point, and we usually recommend that you do not specifically put lotion in between the toes. The reason for that is because it can stay too wet. When there's lotion in between the toes and then you put your socks and shoes on, it doesn't really have a chance to absorb too well, and it creates or promotes moisture in between the toes. So that is an excellent point, and I agree. I would not specifically put lotion in between your toes. The other question about polish, unless your podiatrist told you for some reason that you should not, I would not see a reason why you couldn't put polish. Sometimes when we don't want to treat toenail fungus and it's a cosmetic issue, we do tell people who want to just cover it over with nail polish and ignore it, because again, it's not the type of infection that gets into your blood system and causes you to become sick. So oftentimes you can camouflage it with some toenail polish if you want to. But thank you for bringing up those two issues.
All right, I'm going to sneak in one more just because I think we have time for it. So we have Mamie from Portland, Oregon. You are live and on the air.
Thank you for taking my call. The doctor has said that we should get an annual exam. I go to a foot care nurse every 10 weeks at Kaiser, and she examines my feet and makes a report, and she also sends me home with lotion and has had me order shoes with inserts. So my question is, do I need to do anything else? The only symptoms or problems I seem to have is tingling sometimes in my feet in bed, and you've answered that.
Yeah, so once a year, whether it's your foot care nurse or your endocrinologist or a podiatrist, they're doing that comprehensive foot exam, and it sounds like you're getting one even more frequently than that. But the purpose of the annual, at minimum, annual exam by the foot care specialist is that they should evaluate the systems that we've talked about, the circulation, the nerve function, the muscles and tendons, the skin, and then your shoes. And they decide, well, how frequently should you be seen? And many people, like you, may benefit from what we would call routine foot care, where you go and see a nurse or a podiatrist or any foot care specialist to have your toenails trimmed, any calluses that may be present, those can be worked on as well, and then the recommendation for appropriate shoes. So it sounds like you may be meeting some of those risk factors or criteria for diabetic shoes as well as what we would call routine foot care. So for you, it sounds like everything is going well and that you have those routine visits. I would also encourage people, again, check your feet every day. The annual visit by somebody who's really comprehensively looking at your feet. And then everyone with diabetes, if you're doing one of those exams on yourself every evening or every morning and you develop a problem, you need to seek attention very quickly. So you call the endocrinologist, you call the primary, call your foot doctor, and you say, hey, I've done a foot exam. I see a blister, it's red, I'm concerned, I need to see somebody really quickly. And they should help you expedite that because, again, it's much easier for us to deal with problems on the front end when they're less complicated than when they're more involved and require more aggressive treatments.
All right. Well, this wraps up our last question for the session. A few items before we close today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you, and we hope that you will take a few minutes to provide us with your useful feedback.
To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian about your risk, go to knowdiabetesbyheart.org and learn more, register for the next event at diabetes.org/experts, sign up for diabetes education near you, and sign up for the ADA's free Living with Type 2 Diabetes program. All of these links are on the Ask the Expert registration webpage, diabetes.org/experts. If you have questions about this event, want resources to find diabetes education classes in your areas, or would like to receive an information packet to learn more about living with type 2 diabetes, you are welcome to contact us at askada@diabetes.org or call 1-800-DIABETES. That's 1-800-342-2383. If your question was not answered, please leave a voicemail with your question and email, and we will have an expert respond to you within a week via email. Or you can call back to the call center for a phone response at 1-800-342-2383. Thriving with diabetes takes a village, and we're here to support you. Special thanks to our expert, Dr. Rothenberg. I'm Joe Mandelson, and on behalf of the ADA team, we want to thank you for joining us today. And we look forward to connecting with you at our next Ask the Expert event, October 13th, Navigating Insurance to Get the Diabetes Care You Need. Oh, and one more thing. For more information about heart health and diabetes, we want to invite you to join our partner, Taking Control of Your Diabetes, for their Heart Smart virtual workshop and live Q&A on September 16th. Please visit tcoyd.org to register. I'll turn it over to the survey portion to close out our program. Best wishes for good health.
All right. Thank you, everyone, for joining us today. We appreciate you taking the time to give us feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. And for participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here's our first question. Overall, how satisfied were you with today's event? Best foot forward, type 2 diabetes foot care. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And I'll repeat that for you one more time. Overall, how satisfied were you with today's event? Best foot forward, type 2 diabetes foot care. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And while we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2 diabetes. If you have recently been diagnosed with diabetes or could benefit from a refresher, consider signing up for ADA's free program, Living with Type 2 Diabetes. Participants receive information via email and e-booklets throughout the year-long program on topics including emotional health, eating healthy, and physical fitness, as well as tips on managing and living well with type 2 diabetes. You can find the link to register for the program on our website, diabetes.org/expert. Okay, and we're ready to move on to the next question. How often should an individual with diabetes check their feet? Press 1 for only when they hurt. Press 2 for every day. Press 3 for once per week. Or press 4 for once per month. I'll repeat that again for you. How often should an individual with diabetes check their feet? Press 1 for only when they hurt. Press 2 for every day. Press 3 for once per week. or press 4 for once per month. And before we go on to question 3, we'd like to let you know that if you missed a part of today's event or would like to just listen again, we have recordings available by phone or online. If you want to listen online, you can find the recording on our website, diabetes.org/expert, or you can also call the toll-free number, which is 866-686-8240, and you can hear the recording from the latest event. Again, that phone number is 866-82. Sorry again. The phone number is 866-686-8240. All right, ready for question number 3. True or false? Heart disease can impact your feet by reducing circulation and healing. Press 1 for true, press 2 for false, or press 3 for not sure. I'll repeat that again for you. True or false? Heart disease can impact your feet by reducing circulation and healing. Press 1 for true, press 2 for false, or press 3 for not sure. And before we move on to the next question, we'd like to remind you again that our next Ask the Expert Q&A event will be on October 13th at 2 p.m. Eastern Time. Our guest expert will give us tips on how to navigate insurance to get the diabetes care that you need. To register for that event, go to our website, diabetes.org/expert, or contact 1-800-DIABETES. Again, that's 1-800-342-2383. Okay, here's question number 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that again. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And while we wait for final questions, remember that a diabetes self-management education and support program will focus on your concerns about diabetes. This program will help to empower you with the knowledge and skills to help you manage your diabetes. You can find the link to an American Diabetes Association recognized diabetes education program at the bottom of our website, which again is diabetes.org/expert, or you can call a member of our call center, again at 1-800-DIABETES, and ask them to connect you to a site in your area. Okay, here is our final question. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. I'll repeat that again. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. All right, thank you for staying with us and providing your feedback for today's event. We offer many thanks to our guest expert, Dr. Rothenberg, as well as our support vendors and sponsors and the No Diabetes by Heart collaboration. This concludes today's program of the Ask the Expert Q&A series. We have your email address on file. You can expect to receive an email with resources from today's event. Alternatively, you can find links to the resources as well as the recording of the event on our website, diabetes.org/expert. Go to the September 8th event page under past recordings, and you can click on the links to resources and the full recording of the event. For those who have provided an email address, any unanswered questions from today's call will be addressed by one of our experts and sent to you via email. And lastly, if you have any additional feedback from our team, please stay on live to leave a message. Thank you.